EMT practice tests. Part 4. 61. A 37-year-old male has an apparent foreign body airway obstruction. He is conscious and alert and is coughing forcefully. His skin is pink, warm, and moist. The most appropriate treatment for this patient includes A series of back blows and chest thrusts. B. Finger sweeps to remove the obstruction. C. Performing a series of abdominal thrusts. D. Encouraging him to cough and transporting. The answer is D. Encouraging him to cough and transporting. 62. Which of the following statements regarding normal gas exchange in the lungs is correct? A. The oxygen content in the alveoli is highest during the exhalation phase. B. Oxygen and carbon dioxide diffuse across the alveolar walls and capillaries. C. The actual exchange of oxygen and carbon dioxide occurs in the capillaries. D. Blood that returns to the lungs from the body has a low carbon dioxide content. The answer is B. Oxygen and carbon dioxide diffuse across the alveolar walls and capillaries. 63. The jaw thrust maneuver is used to open the airway of patients with suspected A. Mandibular fractures. B. Upper airway swelling. C. Cervical spine injuries. D. Copious oral secretions. The answer is C. Cervical spine injuries. 64. The cartilage is a firm ring that forms the inferior part of the larynx. A. Cricoid. B. Thyroid. C. Laryngeal. D. Piriform. The answer is A. Cricoid. 65. You are dispatched to a residence where a middle-aged man was found unconscious in his front yard. There are no witnesses that can tell you what happened. You find him in a prone position, his eyes are closed and he is not moving. Your first action should be to A. Palpate for the presence of a carotid pulse. B. Log roll him as a unit to a supine position. C. Assess the rate and quality of his breathing. D. Open his airway with a jaw thrust maneuver. The answer is B. Log roll him as a unit to a supine position. 66. The exchange of air between the lungs and the environment is called A. Diffusion. B. Ventilation. C. Respiration. D. Oxygenation. The answer is B. Ventilation. 67. The purpose of the pin indexing system that has been established for compressed gas cylinders is to A. Ensure that the correct regulator is used for the cylinder. B. Help you determine what type of oxygen regulator to use. C. Prevent destroying or stripping the threads on the cylinder. D. Reduce the cylinder pressure to a safe and more useful range. The answer is A. Ensure that the correct regulator is used for the cylinder. 68. Which of the following would not cause a decrease in tidal volume? A. Shallow breathing. B. Deep respirations. C. Irregular breathing. D. Agonal respirations. The answer is B. Deep respirations. 69. An adult at rest should have a respiratory rate that ranges between A. 8 and 15 breaths/min. B. 10 and 18 breaths/min. C. 12 and 20 breaths/min. D. 16 and 24 breaths/min. The answer is C. 12 and 20 breaths/min. 70. As the single EMTB managing an apneic patient's airway, the preferred initial method of providing ventilations is the A. Mouth-to-mouth technique. B. One-person bag valve mask device. C. Manually triggered ventilation device. D. Mouth-to-mask with one-way valve. The answer is D. Mouth-to-mask with one-way valve. 71. When performing an ongoing assessment, you should first A. Obtain updated vital signs. B. Reassess your interventions. C. Repeat the initial assessment. D. Confirm medical history findings. The answer is C. Repeat the initial assessment. 72. An unstable patient should be reassessed every A. 5 minutes. B. 10 minutes. C. 15 minutes. D. 20 minutes. The answer is A. 5 minutes. 73. The golden hour begins when an injury occurs and ends when A. The patient receives definitive care. B. The patient is admitted to the ICU. C. You depart the scene for the hospital. D. You arrive at the emergency department. The answer is A. The patient receives definitive care. 74. Which of the following signs of respiratory distress is seen most commonly in pediatric patients? A. Nasal flaring. B. Rapid respirations. C. Pursed lip breathing. D. Accessory muscle use. The answer is A. Nasal flaring. 75. When assessing motor function in a conscious patient's lower extremities, you should expect the patient to A. Wiggle his or her toes on command. B. Feel you touching the extremity. C. Note any changes in temperature. D. Identify different types of stimuli. The answer is A. Wiggle his or her toes on command. 76. When assessing a conscious medical patient, the main purpose of the focused history is to A. Obtain information regarding the patient's present illness. B. Determine if the patient's medications caused the illness. C. Arrive at a definitive diagnosis of the patient's condition. D. Systematically rule out causes of the patient's complaint. The answer is A. Obtain information regarding the patient's present illness. 77. Which of the following activities would not be performed during the scene size up? A. Asking a neighbor to secure the patient's dog. B. Rapidly assessing a patient's respiratory status. C. Notifying the dispatcher to send fire personnel. D. Noting the position of a crashed motor vehicle. The answer is B. Rapidly assessing a patient's respiratory status. 78. The most effective way to gain a patient's trust when he or she is communicating with you is to A. Repeatedly ask questions for clarification. B. Ask the same questions to every patient. C. Document the patient's words verbatim. D. Maintain eye contact and actively listen. The answer is D. Maintain eye contact and actively listen. 79. If a pulse cannot be palpated at the radial artery, you should A. Attach an AED at once. B. Immediately begin CPR. C. Assess the carotid pulse. D. Elevate the arm 6 inch to 12. The answer is C. Assess the carotid pulse. 80. Which of the following statements regarding the focused history and physical exam is correct? A. It will allow you to identify specific problems based on the patient's chief complaint. B. It should be performed en route to the hospital. C. It will help you determine whether an initial assessment should be performed. D. It should only be performed on critical patients. The answer is A. It will allow you to identify specific problems based on the patient's chief complaint.